taste with new restaurants here in Rhode Island. It smells pretty fantastic here in the studio. But now we're going to tack to politics, and I'd like to welcome back Dr. Luis Daniel Munoz. Thank you for coming in today.
Thank you for having me.
I'm catching you before an event this evening here in Providence. Independent candidate for governor, really sort of revamping and advancing your campaign with some new messaging, some new ideas.
Absolutely.
So talk with us a little bit about what this entails and what you want the public and the voters to know.
Thank you. Well, just to present a bit of my background again for any of the voters that don't know much about me. I'm a graduate from Central Falls High School, was fortunate enough to excel academically, acquired a doctoral degree in medicine at the University of Connecticut School of Medicine, and then got into the tech industry, specifically medical technologies like medical devices and information technologies. And that entire experience for me was one of growing up, seeing the struggle, understanding the inequities at a personal level, but also kind of maturing and evolving my perspectives, especially as I went through academics and business, and understanding that the decisions that are often made at the top in terms of fiscal responsibility really do have an impact and opportunity at the ground level, and whether those opportunities are accessible. So my vision for Rhode Island is really one that I've tried to encapsulate into 3 initiatives. The first is what I entitled the Dino Program. The Dino Program essentially stands for Dynamic Intelligence for National Opportunity, and it's about giving our youth a big footprint both in the Northeast and throughout the United States. And one way of doing that is for Rhode Island to follow Israel's model of education evolution over the past 20 years, which was essentially to take high school students, some junior high actually, there was some innovation around that, so junior high to high school, start teaching them about technology, the principles of business ethics, help them formulate a critical thinking and an understanding of questions that will drive them towards opportunity. In high school specifically, imagine we took students both from private, charter, public schools, transported them to our private technical universities such as New England Technology, also Bryan University, Roger Williams. Those universities already have after-school programs that are helping youth to acquire opportunity right out of high school. So this is about connecting the dots. And so the Dino Program really is preparing our youth right at the age of, at the grade of 9th and 10th grade with the skills that they can really just go into the industry and do some work. Now, obviously that likely will not happen. So what I believe is that those 16-year-olds can then be empowered to go back to their community as a civic engagement or civic service component in their junior and senior year. They can build a legacy with it, through the vehicle of building something in their municipality. And by building that legacy, they'll stay. And so they graduate high school and now have skills in cybersecurity, they have skills in robotics, diagnostics, and that's not to prohibit them from going to college, but they essentially will be ready for high-paying jobs independent of whether they go to college. Now,
so I'm going to ask you here a little bit. So is this sort of to augment what's already currently in place? Would this be a sort of some structural changes? Would this be a really major overhaul of education in the state?
The only new investment I see is in transportation to the private universities. Otherwise, it's about connecting the dots. So there's some, you might say, somewhat structural changes, but I also believe that the private universities, we haven't been talking about them enough, what they do for our community, how we can leverage the resources that they're offering us. And so there's an element of what I think is, to say it academically, kind of resource sharing that might happen between the universities. Also exposure by our youth to the universities, which I think is a marketing advantage to any university that would participate in the program. Now the Dino Program, that civic engagement or civic service element helps our communities in terms of revamping them, getting everyone really involved and recreating and improving it. But also I believe that the private universities do have merit scholarships, do have programs that earn credits can be acquired for those students. So there's a lot of advantages to just creating, connecting these dots that we've talked about to use the resources we have without spending a lot of money in another building or promising free education that's really just a limited opportunity, seeing that there's only one college that they can go to.
So let's talk a little bit about that. That was a big focus of the governor this year. One of the things that GoLocal had pointed out was a lot of these students aren't achieving the bare minimums to even reach that second year. Was that, in your opinion, not the right approach?
Yes, I think a lot of students that go into CCRI are taking remedial coursework, class is over again, essentially to catch up, which happens, and I'm not criticizing that in a negative way, but I think we need to see what's really being offered. If 2 years of community college are being offered as a vehicle to doctoral program, then I think there's something wrong with that messaging. Whereas I'm saying, let's work with all our universities, let's create a comprehensive program that provides students with vocational skills that they can get high-paying jobs, and also with an opportunity to go back to their communities and to build something and to acquire credits, earn credits for doing that. I think that's really what America represents in terms of opportunity, and I believe that that program would actually foster greater accessibility to more people in terms of actually getting into potentially having a vehicle to a private university.
Okay,
Yeah.
so that's the education component.
Yeah.
You've got a couple more.
I do. The second program is the Rhino program, Redefining Intelligence for National Opportunity. It's an adult version of the Dino program.
Okay.
And so the Rhino program really embodies an initiative to connect the dots with our retraining programs. So right now, if you hear about retraining, you often hear about electric boat, welding, a lot of manual labor. Now those are great jobs, I think, for some people, but there's also opportunities in medical coding, in sensor diagnostics, for manufacturing, essentially jobs where you can sit in front of a computer, put a number next to medical diagnosis, and that helps in how hospitals and insurance companies interact. Now that type of program requires a certification. It's in high demand in the Northeast, not many people have it, and it pays $65,000 plus a bonus. We have amazing industries out there. There's no reason we shouldn't have a retraining program statewide that takes advantage of the diversity of opportunity through certifications that are easy to acquire and that lead to high-paying jobs, not only for people who want to do manual labor, but those that want to just apply the intelligence they have already acquired throughout the years as administrative assistants or any other type of position, and really just kind of repurpose it
So
for industries
in a
demand.
way to address, again, what's already sort of in there for the infrastructure for the state,
Right.
but to, again, target other career opportunities that might not be tapped right now.
Right, higher paying jobs. And also there's this language learning element to the Rhino program, which I believe is not necessarily emphasized well as to whether we have it or not in Rhode Island. There are certainly communities that have English as a second language. They are hardworking. They love the fact that they're an American, right? And they really just need opportunity. So how can we help them get over that language hurdle? And sometimes language can be that they have an ability to communicate but don't have the business language and rhetoric that they need to succeed within the profession. So there are certainly smaller resources, smaller investments that I think will have a larger impact overall that we will make into the Rhino program. The last, so that's opportunity. That's what I believe economic opportunity is. I do think that we need to invest in small businesses. I think we need to redirect Commerce Rhode Island. We need to reduce tangible property tax. All of those nuanced policy issues need to be tackled, or economic issues. But the Rhino and Dino program are my way of saying we must invest in our people, and not just in another building, because our people ultimately represent the facets in this diamond that we call Rhode Island, and we need to make sure they shine brilliantly.
So would this incorporate, you did mention commerce a little bit, a lot of the debate during the gubernatorial campaigns that have already heated up so far has been Commerce RI's approach to those sort of big ticket, big lure, big dollars to bring folks in. Right. Would you say that that might not be your approach if you were governor, that it would be, again, to these opportunity-based programs to provide jobs?
Absolutely. Opportunity-based programs. I do think that we need to, Rhode Island itself needs to define what a small business is. A small business is, that is. Based on the SBA Small Business Administration, they might qualify a small business as one that has 500 employees, $30 million in revenue. I mean, that's certainly not the way that I think we should define it, because that definition of itself has allowed investments to be made, these corporate incentives and whatnot, to companies that in some respect may fall within the realm of helping us, not being that big, but they're huge. And so as we redirect Commerce Rhode Island, I want the Commerce Rhode Island staff to really serve as project managers. They need to go into the municipalities. They need to help us define what a small business is in Rhode Island. They need to help us define whether or certain kind of incentive packages that could serve our businesses. I think every business goes through a valley of death, right? Where just the capital cost, the cost of operations is far too high to continue. Can we help them get through that valley and then ultimately grow, scale, and build our local economies up?
So you mentioned two things pertaining to education and opportunity, both from the K-12, K-16 perspective, also adult learners as well. There's another piece of this revamped puzzle that you're going to tell us about here.
Absolutely. So, and it's also not to forget about early education. Again, there's certain things that we need to tackle in that area, but these programs just embody overall what I believe is opportunity at its focal point. The last program is what the initiative, I would say, is the MENDI initiative, which is Mending and Innovating Community Health Centers. Right now, there's a lot of publicity around how great our hospital systems are, and they are. Hospitals are doing well, specialties are doing very well. I mean, when you have a nonprofit hospital making millions in revenue, I mean, they must be doing well.
Someone's doing well.
Right, but if we really want to reduce the cost of care and thereby reduce our premiums, our health insurance premiums, we have to tackle issues at the ground level, and community health is the ground level. So the MENDI program is a way of really working with all of the community health centers throughout the state. Some have done great work, like in South County, and helping them kind of develop a comprehensive plan around it, dealing with addiction, mental health, care coordination for our elders, and also urgent care services for our veterans. So right now the VA Center has challenges where our veterans need help and sometimes have to wait 2 weeks before they can access a physician because the coverage that they have doesn't essentially work with another type of institution, private institution or nonprofit. Now, there's some policies around that are trying to help veterans at the federal level with an insurance company called Veterans Choice. But at the state level, I think we need to do more. Again, to ensure that our veterans are taken care of when they need care, that our elders can be guided at the community health level, that they can possibly even stay home more, have resources, assisted living at home. And so the MENDI program the hypothesis is this, the idea is this, that if we can help people at the ground level by just helping them know where to go more immediately and leveraging things like this, Skype, telemedicine, devices that give information to doctors while the patient's at home or in the community health center. If we can do these things, then by making that small investment, and frankly, maybe even just using the investments that have already been made in some of these health centers, then not only will we care for people, but we will reduce total cost of care, we will reduce health insurance premiums, and that, in my perspective, provides me with more leverage as a governor to continue to make sure that those prices, that burden, that cost burden for families continues to go down.
Well, I appreciate your coming in
Thank
to,
you.
again, give this, your proposals here moving forward. What is next in the campaign trail? You've literally got an event on Broad Street at 5.
Right. So heading over to the event, it's at 500 Broad Street, restaurant in Providence, Punta Cana Bistro. It's me sharing this, I would say, with more of a personal story as to how I've gotten here. But really would love to see you there if you'd like to attend. Otherwise, it's just going to continue. I know that there's been not so much activity in certain social media platforms, though now we're ramping up, but it's really because I've been spending time walking. When you walk down a single block, whether it's Hope Street in Bristol or Broad Street and Elmwood Ave in Providence, you start to realize that one half of the street businesses have one need, and then the other half businesses have another. And many of those businesses are saying that they haven't seen council people or specific political officials in some time. And in my perspective, how can we really tailor opportunity to the communities, the people, unless we're with the people? So I join anyone who's listening to join me on the road as I walk and as we engage others, because ultimately my candidacy, I believe, represents the only true vehicle to change, to positive change for Rhode Island, to a better Rhode Island, and not just a party Rhode Island.
So as we heard from you, you've been on the streets listening to folks formulating what these positions are. We're going to provide those for you on GoLocal as well. Again, going to be out tonight and around. We'll provide links to the doctor's campaign. Dr. Daniel Munoz,
thank you so much for
taking the time to come in. I'll let you go around the corner.
Thank you.
And we'll be right back here in the Navigant Credit Union Broadcast Center with our next guest.